Conduct disorder is an emotional and behavioral disorder in children and teens characterized by one having little disregard for others, which in some cases can lead to violence. This affects approximately 2 to 16% of all children in the U.S. Common signs of conduct disorder in children include aggressive behavior like harming animals, people, bullying, destructive behavior such as vandalism, and issues following rules and authorities. If these symptoms persist over a long enough period of time, one could be diagnosed with conduct disorder.
Hi, my name is Nefemi, and I'm going to be talking about depression. Depression is a common and serious medical illness that negatively affects how you feel, the way you think, and how you act. A fact about depression is a lot of people with it do not know they have it. It is important to reach out to people who can help you if you feel this way. A lot of depressed people feel like they are not important, and if you're listening to this, you are more than important. You are totally worth it.
We'll be discussing pediatric bipolar disorder. This is also known as manic depressive illness or bipolar affective disorder and causes extreme mood episodes that occur in cycles. An adolescent with bipolar disorder has both manic phases of abnormally high energy and depressive phases of intense irritability or sadness. They can also experience both phases at the same time in what is known as a mixed mood episode. The symptoms can persist for days, weeks, or even years, and can go away but will return without treatment. According to Boston Children's Hospital, bipolar disorder affects up to 3% of all children. The illness requires continuous treatment but has no cure, so it is important to recognize the symptoms of bipolar disorder early on so that those affected can receive proper treatment and return to normal functioning.
What is PTSD? PTSD is a mental health condition which is triggered by a traumatic event that was either experienced or witnessed. Some symptoms that are found in children who meet the criteria for PTSD are bad dreams, which reenact the event, difficulty maintaining relationships, difficulty concentrating, and disinterest in formally significant activities. PTSD affects a child by having them feel a lot of emotional and physical distress when exposed to situations that remind them of that traumatic event. Studies show that about 15% to 43% of girls and 14% to 43% of boys go through at least one trauma. Of those children and teens who have had a trauma, 3% to 15% of girls and 1% to 6% of boys develop PTSD.
ADHD is the most common neurodevelopmental disorder of childhood. Some symptoms include daydreaming a lot, often forgetting or losing things, and careless mistakes. There are two types of ADHD. Predominantly inattentive presentation, which is when it is hard for the individual to organize and follow instructions. Also predominantly hyperactive impulsive presentation, which is when the person fidgets and talks a lot.
Schizophrenia is a mental disorder that affects a person's ability to think, feel, and behave clearly. About 1.1% of the population is diagnosed with schizophrenia. It has also been estimated that 1 in 10 people diagnosed with schizophrenia take their own life. If you or someone you know notices symptoms such as delusions, hallucinations, disorganized speech, trouble with thinking, or a lack of motivation, you may have undiagnosed schizophrenia.
Separation anxiety disorder, otherwise known as SAD, is a disorder in which a child becomes nervous and frightened when separated from a loved one, usually a parent. SAD usually affects children between the ages of 7 and 11. It is also possible for adults to have separation anxiety and even experience panic attacks, but it is more common in children. According to Grow by WebMD, separation anxiety affects approximately 4 to 5% of children in the U.S. Some symptoms of SAD are the fear of being alone, refusing to sleep without a loved one nearby, intense fear while being alone, a worry that something bad will happen to themselves or their loved one when separated, etc. SAD could also cause other anxiety disorders such as agoraphobia or social anxiety disorder. Please educate yourself on mental illnesses so that you can spread awareness. Thank you.